Dr. Denise Ejo, the CEO of Cervical Cancer Foundation. I would like to welcome you to our Cervical Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
All right, thank you for still being there. We told you earlier we will be continuing our campaign, that is cancer awareness segment right here on Kakaki, the African Voice. Now this comes up every second and fourth Wednesdays of the month, and we do this in conjunction with Cervical Cancer Foundation. So to discuss this issue and tell Nigerians exactly how to deal with cancer, prevention, treatment, and of course testing as well, we have two ladies, doctors in the house. First of all, the Cervical Cancer Foundation founder, Dr. Denise Ejo, will be joining us. Okay, right there she is on Zoom from our virtual platform. Thank you very much for joining us, Dr. Ejo. And also joining us right here in the studio is Dr. Tessy Amadu, who is a nuclear physician. She's also a clinical radiation oncologist. It's a pleasure to have you in the studio.
Good to have you.
Thank you for having me.
All right.
Dr. Ejo, good morning. Thank you for joining us today. Good morning. Can you hear us?
I can hear you, but I can't see you.
Oh, wow. Okay. I can see you. Looking very radiant this morning.
All right, while we try to sort that out, we'll begin with you, the clinical oncologist in the house. Okay. Now, cervical cancer really is said to be one of the most preventable and treatable form of cancer, but at the same time, the gravest threat to women's lives. How bad is cervical cancer?
Okay, I would say the burden of cervical cancer is actually enormous. Worldwide, cervical cancer is the fourth commonest cancer in females, and in 2020, over 300,000 deaths were due to cervical cancer. And it is worthy of note that over 90% of those deaths were actually from sub-Saharan Africa. So you can imagine how what it is to us in the sub-Saharan Africa. In Nigeria, coming back home, cervical cancer is actually the second commonest cancer in female. It's second to breast cancer. And of course, it affects the peak age group that is affected is between the ages of 35 to 45. That's the peak age. And when you look at that age, it is when women at their prime, and that's actually the active workforce of the country, and female are in the reproductive age group. And so you can imagine the enormous burden it places socially, economically, and even psychologically to the family unit and the country at large. So I would say the burden of cervical cancer is actually very, very enormous, and more so in sub-Saharan Africa.
All right, let me go back to Dr. Denise Ejo. I mean, cervical cancer is the fourth most common cancer in women, and I think that's huge. Let's take it from you. I mean, give us a background in, as with all cancers, what is the danger of this?
Good morning, everyone.
Good morning.
Good morning.
Okay. I'm just trying to check. Okay. I'm not coming from it from a medical point of view, so I'm not going to be answering the medicals. Dr. Tessy is going to be answering all the medical questions. However, how often, because we're told it is the most common, is one of the most common, but actually it's actually one of those that also is very easily identifiable. How do we move forward with that? Because we know that it's identifiable, and we know that it's not that hard to go ahead with it.
Okay, that question is putting the across to you. Did you hear her?
Okay, not really.
You didn't get the question.
I didn't get the question.
Okay, could you put that question again for Dr. Tessy?
Yeah. Dr. Tessy, often we are told that most of the cases of the cause of cervical cancer is unidentified.
Okay.
So I'm using the word unidentified and unknown.
Okay.
Yeah. Is there any identifiable cause for cervical cancer?
Yes, there is. More than 90% of the cases of cervical cancer is actually attributed to the human papilloma virus, long-standing infection with the human papilloma virus. Of course, there are other risk factors that make patients more at risk of having cervical cancer, and we have things like having multiple sexual partners, a young age, very young age at first sexual intercourse, very young age at first pregnancy, having sexually transmitted infections, and also multiple births. And also we have things like smoking. The risk of having cervical cancer is actually like 3 to 4 times more in women who smoke compared to non-smokers. And then the presence of an immune suppressive disease, especially HIV, can also increase the risk of having cervical cancer. So yes, human papilloma virus accounts for over 90% of the cases of cervical cancer, but long-standing infection.
Long-standing infection.
Long-standing infection.
Okay, doctor. Okay, Denise. Denise.
Yeah, go on.
Yeah.
So therefore, could you briefly give us a summary of the symptoms? Because I think that would help our viewers be able to identify what they need to be looking out for.
Okay, so the symptoms of cervical cancer actually varies. It will depend on the stage where the disease is peaked. Patients can actually be asymptomatic, that they don't have any symptom, and this is very common in people who screen. When the cancer, cervical cancer is gotten at the screening stage, where it's at a very early stage, the patient might not have any symptom, and then it is caught at that stage, and that is the stage where we actually want patients, this cancer to be picked up, because the incidence of cure is as much as 100%. But when the disease progresses and the stage increases, then of course there are visible symptoms that the patient can present with, amongst which we have vaginal bleeding. Vaginal bleeding, of course, can be intermenstrual bleeding. That's bleeding in between the normal menstrual period. It can also be prolonged or heavy bleeding. The normal menstrual bleeding, but now it's more prolonged or heavier than usual. It can also present as postcoital bleeding. That's bleeding during or after a sexual activity. There can also be, in women that have actually stopped menstruating, postmenopausal women, you can have an onset of menstruation again. That's abnormal, and it can actually point to the fact that there's something sinister. And then we could also have they could also have postcoital bleeding after sexual intercourse. So all those things would raise your give an idea that something sinister is going on. You can also have abnormal vaginal discharge. Of course, every woman has the normal vaginal discharge that is necessary. It's normal for the vagina, but when you have vaginal discharge that is copious, that's plenty, it's of high volume, sometimes they even need to use pad to hold it, and then it's also very, very foul smelling. It smells, and sometimes fleshy parts, substances in it, and all that. Those kind of that's the description of the type of discharge you find when a woman has cervical cancer. The smell, especially, it's
awful,
very awful. And then, of course, apart from that, there can be lower abdominal pain and then waist pain. So when you have these ones, these are symptoms that are confined, when the disease is still confined to the to the cervix. But then when surrounding structures around the cervix get involved, like when the stage, that it gets to an advanced stage, then you start having affectation of surrounding structures, like if the kidney and its outflow is affected, the patient can start having, patients will have difficulty with passing urine, reduced volume of urine, and they can even have swelling of the legs, facial puffiness, and all that. If the liver is affected, because it can also move outside the cervix to other parts of the body, vital organs of the body, like the liver, the patient might have jaundice and also have abdominal pain on the right side. If it's affecting the lungs, the patient might have difficulty with breathing, might also have cough, persistent cough. If it's affecting the bone, patients can have bone pain. And of course, there are other constitutional symptoms like weakness, generalized body weakness. Patient is always weak, and most times, because they bleed, they lose blood, and they are listless, they are, weak. They can also lose weight and loss of appetite. So generally, the symptoms will actually depend on the stage where the disease is picked.
So it means they can move from the
cervix where it is confined to other parts, surrounding structures, and then distant organs.
That's quite scary, really. Okay, before we go to Denise again.
That's very interesting.
Yes, Dennis, we'll come back to you.
It's very interesting to hear that, because when you look at it from the perspective of women already going through cancer, we have to always recognize that there are some of the symptoms you just listed are very common across all cancers or cancer patients, which I would look at things like nausea. But when you're looking at it and from a specific point of view, the staging becomes very important. Am I correct in assuming that?
You're very correct.
Okay, so then in which case, so how long does it take for a woman to have treatment for cervical cancer? Because that then becomes very paramount in understanding the implications for a woman.
Okay, so I would say the treatment will also depend on the stage at which the cancer is picked. When patients are picked in the very early stage, the treatment is basically a local treatment. But I want to say the treatment of cancer, for any cancer for that matter, is usually a multimodal thing. Usually there are various forms of modality of treating, and then the stage will now determine how you combine this treatment. So for cervical cancer, at the early stage, it's because it's still confined to the cervix and it's a local thing. Surgery is the mainstay of treatment. It's either the patient has surgery or radiotherapy. And with this, surgery the surgery can range from a minimal surgery to as much as removing the cervix and the uterus. But when it gets advanced and out of the confine of the cervix, then you have to use a combination of chemotherapy, radiotherapy to treat the cancer. So the timeline, I wouldn't want to put a timeline on it because it depends on the stage of the disease. But of course, when you have an early stage disease, then the treatment is going to be surgical and it's going to be prompt and not as long as when you have an advanced stage disease. And then the treatment of cancer is not a one-off thing. A patient who has cancer is like your patient for life, because even after treatment there needs to be follow-up to check for the complications of the treatment that you have given, and also to think of to see if there will be recurrence or things like that. So I would say basically for patients that have not too early disease, their treatment will range from having a surgery which will take about a week, from the day of the surgery to when the patient recovers fully and is discharged. And then the patient will need to have chemoradiation therapy, and this will take about 6 weeks, and then brachytherapy. So I think the whole thing will take about 10 to 12 weeks to have a complete treatment for patients that would have a combined modality of chemotherapy, radiotherapy for the disease.
Thank you. I really appreciate this, because one of the things that I think has been a misconception is the fact that people don't recognize you have to keep going back. It doesn't end once you've had cancer. You always have to go back and follow up on your checks. Now, for cervical cancer, what age should women start cervical cancer screening, and how often should we come? Should it be done? Should it be done? Because I know research is now showing various discussions on what the ages length of time you can do the screening is.
Okay. Basically,
did you get that? Yes.
Yes, I did. Basically, I think women can start screening from the age of 21, have their pap smear done from the age of 21, and if you have a normal pap smear, then you can repeat three yearly after 3 years of that. So from the age of 21. Some other people also feel that you can have it 6 months to 1 year post commencing sexual activity. So because we know that cervical cancer, the incidence and everything is tied up to sexual activity, to human papilloma virus, which of course is a sexually transmitted infection. When it is long standing, then it can predispose to abnormal cells, and then get to the pre-invasive part, and then to cancer. So we want to get it at that period where it is pre-invasive. Pre-invasive means it is not yet cervical cancer. It is still in that stage where it is pre-cancer. So the aim of having the pap smear done 3 yearly is to make sure that you can get it at that stage where it is still pre-invasive, and it can be cured or it can be prevented from happening.
That was actually my next question about how we can be sure or how it can be prevented. That was actually my next question for you.
Okay. Cervical cancer, yes, is very, very preventable. Remember I said over 90% of cases of cervical cancer is caused by the human papilloma virus. The human papilloma virus actually has over 200 strains, but there are some that are called the high risk human papilloma virus, and these are the ones that are associated with cervical cancer, like the type 16 and 18. So what vaccines, there are vaccines available for young girls to prevent human papilloma virus infection. And so the human papilloma virus vaccine is available, and the age where young girls can actually access it is between the ages of 9 to 26. It is actually more preferable to have it at younger age, between 9 to 15. So when you're having it between 9 and 14 years, 2 doses can be given, one the initial dose and then 6 months later. When you're having it after from the age of 15 upwards to 26, then 3 doses can be given. That's at the initial dose, 1 to 2 months later, and then 6 months later. In the US and Canada, there are also vaccine are made available actually to women even from 26 years, between 26 years and 45 years, because of the concept of reinfection by human papilloma virus. It is believed that when you have an infection, it doesn't give you a immunity. You can still have a reinfection. So in places like the US and in Canada, where of course their screening processes are at top notch, they are actually now advocating for women to have vaccine even from the ages of 26 to 45 to prevent reinfection by human papilloma virus. So yes, preventable. Yes, you can have it between the ages of 9 to 26, best between 9 and 15 years.
Thank you very much. There's thank you for your time, actually, Dr. Tessy. I want to ask you one: how accessible is this for the young adults? I put them as not just young adults, the children and the young adults who need to get this vaccine. How accessible is it for them in Nigeria?
Well, the vaccine it's not yet part of the normal routine vaccine of the country, and so I wouldn't say it's accessible as per the the national schedule. But of course, it's available, it's been sold, and once people, anyone is interested and you approach your gynecologist, I think you can have it. It's available. It's actually available, but it's not yet part of the national immunization schedule.
So does that mean that because based on what you've just explained to us now, with the HPV, we have a better chance as we grow older. So if we had it very young, we're likely to at least have a bit of immunity. Is that the right word?
Of course.
As against children who don't have it at all.
Yes.
Because one of the reasons I'm asking is that in Nigeria, our marriage ages can be quite young. And based on your explanations of the processes and how you get it and how it spreads and where it's preventable, how important therefore, because there must be some way, is there a drive we need to do across the country that's going to help us to get more children involved in having this vaccine?
I think the most important way this can actually get to be done is to introduce it into the national immunization schedule. I think that's one of the best way that we can have it, more accessible, and also, make parents want to have the kids have it. Or else, I think we will still be lagging behind a lot. In most countries, that it is made part of the schedule, and so they have actually gone past, trying to prevent it, and they are actually, like in Australia, they are almost having 100%, this, and this is because they have, well scheduled vaccines for this purpose. So I think adding it to the national, to our national immunization schedule would go a long way to help. A really long way to help.
Okay. So in which case, if I was to summarize for today what you've talked about, because this month is Cervical Cancer Awareness Month, and a lot of organizations are really driving the awareness campaign and provision and access to the drugs. If we were to be wanting to advocate for young adults not young adults, young children to be involved in it, isn't there supposed to be an awareness through the schools? That is where I come from, because I'm a teacher, whether you like it or not. So children, if we create the awareness through literature and schools, will that not help us to be able to create a faster, stronger awareness, like it's done everywhere in very, very big developed countries?
Okay, of course, the role of awareness cannot be overemphasized in this case, especially. Remember that there are so many myths and so many things to do with vaccine, and we're talking about even the normal vaccines for diseases that are common, but now you're looking at a disease that is actually even related to sexuality, is related to the reproductive organ. I'm sure that there's going to be a lot of misconceptions, a lot of myths, a lot of pushback from people. Even parents may not even want their children to have it because it might just be associated with infertility and things like that. So a lot of awareness, the role of awareness cannot be overemphasized in this case. We need to have massive awareness at the level of schools, at all levels, to make sure that, apart from even the children, the parents, because these are still minors, and of course the parents will have to agree and take these kids out to have the vaccine. So massive awareness is very, very important, especially around the fact that the HPV vaccine is somehow related to sexuality, is related to the reproductive organ, and it will not be embraced easily. And I think that's one of the drawback also, even in as much as the vaccine is available and it's not that expensive. Most of the parents are actually not accessing it not because of the cost, but because of the various myths that are associated with it. And all these have to be dispelled. Parents have to, they have to be more aware of what they stand to gain when their children have this. And then we can now start talking about, rolling out the vaccine at national level. So yes, awareness is actually the first thing that needs to be done.
Thank you very much, Dr. Tessy, because one of the things I was trying to drive, awareness is very central to the drive for Common Cancer Foundation, and I believe that if people know that if we're educated, we will make the right choices. So making the right choices, we want to say thank you to AIT because you continue to support us in driving knowledge across the country. Dr. Tessy, thank you for coming and answering our questions this morning, and we'll come back to you to come and ask you more questions as we go along. Cervical cancer awareness can be seen all around. I think almost every NGO in Nigeria is actually involved in cervical cancer awareness this month. So people who need guidance can easily access it, as far as I'm aware. I wish everyone a wonderful day, and you can follow us on Common Cancer Foundation, any of our Instagram pages, social media outlets, or even email us. We'll always get in touch with you. Thank you very much.
Thank you, Dr. Dennis.
All right,
Thank you. Thank you.
Thank you, Denise Ejo, founder, Commod Foundation. She has asked all the questions. Of course, AIT is doing this in conjunction with Commod Foundation to raise awareness on all forms of cancer. Today we are dealing with cervical cancer. But just before we let you go, Dr. Amadu, you've really done a really good breakdown of all of this. But I read something that 9 in 10 women, you talked about the prevalence of cervical cancer in sub-Saharan Africa, and I read something that 9 in 10 women who die from cervical cancer are said to be in poor countries. So I just want to ask, why is that so, and is there a link between poverty and cervical cancer somehow before we go?
I think I missed that out. Very important. Actually, there's a big link between poverty, the social-economic status of a woman, and cervical cancer. And I think it has to do basically with accessing care, accessing screening and preventive measures. Because remember, cervical cancer actually gives you a long rope to pull. The HPV infection, remember I kept saying long-standing.
Yes.
It has to be long-standing. It takes time. It takes between 10 to 20 years before it becomes an invasive cancer proper. You understand? So at that period, you can actually, when the screening process is intact, you can assess pap smear and all that, regular pap smear and things like that. Then, it can be prevented. So when you don't have those things, then, and maybe poverty and, low socio-economic status, women are struggling to even have a meal per day. They don't think about screening for anything. They don't even have the wherewithal to do that. The fund is not there. Even to travel to where they can access this is not even there. You understand? So all these are tied around it, and that's why, of course, it plays a very, very big role, because of course screening and preventive measures plays a very big role in dealing with cervical cancer.
All right.
Thank you so much.
Very
apt
question.
Yeah.
Thank you. Okay, Dr. Tessy Amadu is a radiation and clinical oncologist, so you understand exactly the point she's coming from in clearing all of these issues. She's also a nuclear physician. She's joined us. Thank you very much. And Denise, you've gone, but we thank you. She is the founder of Commod Foundation.
Thank you for joining.